And also big news in Maine, there was we've been talking about which states have passed legislation to allow same-sex marriage, and Maine was on that list. And I say was because voters actually rejected the new same-sex marriage law in Maine, 53 to 47. And unlike many of the non-binding opinion questions that are on the odd-yeared elections, this actually was a binding resolution, and same-sex marriage in Maine has been repealed. So on that list of slowly growing states that allow same-sex marriage, we can now cross Maine off the list. And I'm not sure what the long term will be. I don't know if this can be, I can't imagine that this is the end of this forever, but certainly for now, it's not progress. It's not the direction I would expect that the country is generally going to go, which is more and more states allowing gay marriage.
I'm sure this will come up again, on ballots, and I'm sure eventually, it will go the opposite way.
It's interesting because I don't have the numbers in front of me, but Maine also voted to further, I don't know if decriminalization is the right word, or if allowing for some kind of personal marijuana use. My point is that in conjunction with voting to repeal the same-sex marriage law, Maine voters also voted to make marijuana less of a crime or more available, or to liberalize marijuana-related legislation, that is. So kind of conflicting there. And I'm curious what it is specifically about Maine that swung this. Now, 53 to 47 is not a lot of people who make up that difference, and there may be something specifically about Maine and maybe northern Maine, I would imagine, that swung this.
Perhaps. I don't know. Pretty close. But like I said, when it's that close, I'm sure it'll come up again.
Let's talk about healthcare a little bit here. $700 billion, one estimate says, is wasted annually in terms of dollars in the healthcare industry. And this is a pretty shocking revelation to me. To put the amount at $700 billion is pretty intense to me. Health insurance right now provided by employers only covers a little more than half of the American people. And of the $2 trillion in healthcare spending, one estimate says that $700 billion a year is being wasted. So here's some estimates of where this waste is coming from. Unnecessary care. This is close to half of healthcare waste. And this includes unwarranted treatment, such as overusing antibiotics. We know, Lewis, many doctors overprescribe antibiotics because a lot of people actually ask for antibiotics. They say, well, I could wait 5 days to see if this is a viral thing, but I'd rather just start the antibiotics now. I don't really have time. I have to go to work. Understandably, I have to work for my health insurance. So overuse of antibiotics, overuse of diagnostic lab tests, which again is a malpractice-related thing. Doctors, in the abundance of caution, due to concerns about malpractice lawsuits, will over-diagnose blood tests, MRIs, X-rays, so on and so forth. This is about 250 to 325 billion in annual healthcare spending, which some say is waste. About 19% of healthcare waste is fraud. So healthcare fraud, around 150 billion a year, and this can be everything from fraudulent insurance and Medicare claims, kickbacks for referrals for unnecessary services that some doctors have arranged, administrative efficiency, which is a big one that the government plan advocates have been mentioning. Large volume of redundant paperwork in the U.S. healthcare system. Over $100 billion in spending comes from paperwork that many say is redundant. Healthcare provider errors, a little over 10%. This includes medical mistakes and unnecessary spending. Preventable conditions are a small part of this. 6% of healthcare waste is related to hospitalizations that address conditions such as uncontrolled diabetes, very often a low-income obesity-related problem. Much less costly to treat when the individuals receive preventive care, much more expensive when we get to this point, and also lack of care coordination. And this just means there's not proper coordination between providers, and this could be everything from expenses related to getting those x-rays up on the computer and to the right doctor, to the right specialist that you're seeing, getting the tests administered properly, not having to re-administer tests for reasons such as they just didn't get to your primary care provider. So when it comes to preventable conditions, the United States over time might actually realize far greater cost savings than the 25 to 50 billion that is estimated. So for example, some studies have gauged the impact of American obesity, for example, the American obesity epidemic, at $147 billion a year. And a hands-on example of this is that the cost of treating the diabetes that's often related to obesity can run as high as $190 billion a year. An August 2009 study by PricewaterhouseCoopers claims that risky behaviors such as smoking, obesity, and alcohol abuse combine to produce a $493 billion annual price tag for the United States. So it's great to have this information. It really is. But the question is, how do you address each of these? How can we change a lot of these issues? When we talk about healthcare reform, I mentioned in the last couple of weeks that while there is an effort to remove the pre-existing condition waivers or exemptions, that obesity is likely going to stay in there. And as we talked about, obesity can be linked to pre-existing conditions. Who's more likely to be obese? Low-income individuals, as well as people with diabetes, heart conditions, extenuating serious catastrophic medical conditions that prevent you from exercising and may also affect calorie intake, eating right. So all of these things, I feel like it's great to have these numbers, but how exactly do we address all of these? I don't know. We'll have to keep an eye on these things and see what actually can be done. And I'm going to be interested to see as well, Lewis, what happens with this healthcare reform plan, which we will get to quite a bit later, the minutia, including Joe Lieberman and much else.